Hey everyone, and welcome to Open. I'm Rhina Valentin, your host of Cafe con Leche for the next hour, inviting you to get social with us online. That is, tweet us and follow us on Instagram at BronxNet TV and like us on Facebook at Open BronxNet Television. And of course, while you're there, follow moi on Twitter, FB, Instagram, Insta Stories, LinkedIn at Rhina Valentin. So as 2022 begins, we are met with yet another COVID strain, the Omicron variant. And as it rapidly spreads throughout New York City and the country, according to the New York Times, there are 4.19 million cases in New York State alone. Many people vaccinated or unvaccinated are left with questions about what we can expect from this new variant. And joining us to share more about the differences between the Delta and Omicron variants, symptoms, and what we can do to stay safe, we welcome infectious disease specialist at Montefiore Medical Group, Dr. Eric A. Meyerowitz. Hello and welcome.
Hi, Rhina. Thank you. Good to be with you today.
Yes, well, happy, healthy New Year, and may it stay that way for all of us.
Same. Yeah.
Thank you. And so, can we just start with the difference of the variants, because it is a question I think we're all curious to learn about, right? And why are they named? Why do they have different names? Why do both these variants have different names?
Yeah. So that's a great question. It's something that a lot of people are thinking about. So importantly, both of these variants are still SARS-CoV-2 virus. So that's the original virus that causes COVID, right? All RNA viruses. So things can either be made up of DNA or RNA. Those are kind of the genetic building blocks of viruses. SARS-CoV-2 is an RNA virus, and it turns out that all RNA viruses mutate. And so over time, they have specific changes to their RNA, to their genetic code, that occur in a random fashion, but ones that give a selective advantage to subsequent viruses can be selected for at a population level. So very early on, it became clear that there were slow changes happening to the SARS-CoV-2 virus. The Delta virus emerged last spring, first in India, and then spread rapidly around the world. And what was notable about that, there were about 13 total mutations, about 9 in the spike protein. So that spike protein, if you can picture the way that the virus is depicted, there's kind of a circle, which is the where the virus is contained, and on the outside you have these kind of Y-shaped spike proteins. Those are the proteins that bind to our cells to get inside. So of the 13 mutations in Delta, there were 9 in the spike protein, and it became clear that Delta was about twice as transmissible as the original virus, meaning twice. If you're twice as likely to pass it on as compared to the original virus. It was also clear that it caused significantly more severe disease, probably because it binds a little bit better to lung tissue, right? The Omicron variant, so whereas Delta has 13 total mutations, about 9 in the spike, the Omicron variant has more than 50 mutations and more than 30 in the spike protein. Okay, so just a very high number of changes, and it's becoming clear, although it's still relatively early. It's becoming clear that Omicron is even more infectious, perhaps about twice as infectious as Delta, right? So Delta about twice as infectious as the original strain, Omicron maybe about twice as infectious as Delta. And so what we're seeing over the last several weeks, first in South Africa, then in parts of Europe like London, right, and now here throughout the United States, is we're seeing Omicron displace Delta and become the dominant strain.
So, but how are we able to identify that, right? When we're going and we're being tested solely to recognize whether we're either positive or negative, and not really differentiating the two variants.
Yeah, so in the United States, that's not done on an individual basis. So states and the CDC are collecting kind of random samples and are able to determine what is circulating. So it turns out now more than 98% of what is circulating in the US is Omicron. So people getting infected with this virus, that their positive test is just going to say, positive either for COVID or positive for SARS-CoV-2. But pretty much everyone getting infected right now in the United States is infected with Omicron.
So, okay, and so why is it that people who are vaccinated and boosted are still contracting Omicron?
So when we think about the protection from vaccines, there's a couple of different ways to think about it. So one is whether there is protection against actual infection, and the second is whether there is protection against severe disease and death, right? So severe disease includes needing to go to the hospital, needing supplemental oxygen, maybe needing to be put on a ventilator, or obviously in the worst case, dying. So it turns out that the vaccines that came out, starting last December, had extremely good protection against all of those things, both for the original strain and then for Delta. So in the protection against overall infection for Delta was around 90%, and then waned over time if you'd been vaccinated several months earlier, which is why the recommendations for boosters started to come out towards the end of the summer. It turns out that the protection against infection for Omicron, particularly if you just have two vaccines from either the Moderna or the Pfizer series, is significantly lower. So you probably don't have much protection against overall infection. You do get protection. You do get some protection when you add a booster to that, but it does not rise to the level that you had with Delta. What you still have significant protection against is getting really sick, right? So getting hospitalized, needing supplemental oxygen, or dying. You have protection even with two vaccines. That protection is going to be stronger when you get boosted.
Okay, and so how long, or how much time should you be allotted for a booster? How much time, from the last vaccination that one's injected, should one get a booster?
Yeah, this may be changing, and so I think the most important thing to say is that everyone should keep an eye on it as this changes in terms of looking at the news, looking at CDC, speaking with your doctor. The current recommendation is to get a third shot around 5 months after your second shot.
Wonderful.
So many people were vaccinated right back a year ago, and so if you're in that situation, you're definitely due for a booster, and you should go out and get one as soon as you can.
And so before we go, what should people in the Bronx do to keep their families and friends safe?
I think the most important thing to say is boosting is so important. So the people that we're seeing who are hospitalized right now from Omicron are people who are either unvaccinated or undervaccinated, meaning one dose or two doses a very, very long time ago. So I can't overstate the importance of that. The other thing is, right, we are still in a period of extremely high community spread. So the same sorts of things that helped prevent the spread of the original strain and of Delta still work for this. So using masks, it's important to say that higher filtration masks, so things like KN95s or N95s, are going to provide better protection than cloth masks, probably than surgical masks, ventilation is extremely important, right? So at this point, with such high community prevalence and spread, indoor gatherings where people are unmasked are high risk. If you can move those gatherings outdoors, that makes it safer. If you can't do that and you can open a window, you can help improve ventilation. If you can't do any of those things, then trying to stay masked indoors when you're gathering is the best way to keep you safe.
Wonderful. Thank you. Thank you for all the advice. Thank you for making the time to share this with our viewers. Once again, everyone, that's Dr. Eric A. Meyerowitz, who is the Montefiore's infectious disease specialist. And if you are interested in finding a doctor in your area, you can visit montefiore.org/doctors. And for more information on where to get vaccinated and the booster shot, you can visit finder.nyc.gov. And for information on the Omicron variant, you can visit cdc.gov.